Okay, why don't we get going here? Good morning, good afternoon, everyone, depending on where you are in the world. My name is John Skibiak. I'm the director of the Reproductive Health Supplies Coalition, and it's a pleasure to really welcome you here this morning to this webinar on the LEAP custom reports, which in many ways is kind of closing the loop on our initial launch of LEAP, which took place just about 6 months ago. The LEAP analysis, as you know, builds on nearly 20 years of experience in estimating the growth in the demand for family planning supplies and figuring out what it would take in dollar terms to meet that demand. In the LEAP report, though, we look beyond family planning to include the broad spectrum of reproductive health areas: maternal health, abortion, post-abortion care, and menstrual health. And really thanks to the colleagues at Avenir, Michelle Weinberger, Nicole Bellows, Megan Rady, Rachel Sanders, Jillian Ava, Judy Gold, and so many others across the RHSC. We now have a tool that really has become kind of the go-to support source for demand and cost projections across the reproductive health space. I was just looking at some of the figures that we track on use of the tool. And since August, since we launched this, we've had over 11,000 views. In September, immediately after the launch, we had over 600 separate viewers, but even since then, we've been averaging about 200 per month. So I think the use of the tool has really been impressive. I think the utility of any tool really hinges on its ability to allow the user to dig deeper, to compare data, to mix and match. In the old costed gap analysis, we achieve that with our country reports. And once again, under the LEAP analysis, we build on that experience and plan from the very beginning to do the same with this. It's taken a bit of time. It's taken a few months to get us there. But I think now with the LEAP report, custom reports, we're in that place where finally we can start seeing the trees as well as the forest. I don't want to take up too much time because I want to let Michelle really speak to so many of the topics we want to discuss. But I just want to kind of mention a couple things. One, this recording or this webinar is being recorded. Michelle is going to talk for about 35 minutes, presenting the LEAP custom report. And then we're going to take questions. So, I would encourage everyone, if they have questions, to put them in the chat. Nicole and Rachel will be moderating the questions, providing them to Michelle so she can answer. If there are any questions that we can't address during the course of today's webinar, we'll certainly try to get back to everyone with questions that remain unanswered. So I think with that, it's my pleasure to turn the mic over to Michelle.
Great, thank you so much, John, and thank you to everyone who joined us this morning. So for today, I'm going to give a very quick overview of LEAP, and then we're going to spend most of our time looking at these new custom reports that just launched and talking through each of the 3 different types of custom reports. There's a custom landscape report, a comparison report, and then a product deep dive. And as John just said, we're going to save plenty of time at the end for questions and answers. So please do be putting questions or comments that you might have as we go through into the chat so that we can come to those at the end. So LEAP is really telling 4 unique stories, but that all really come together into one picture. And so even though we talk about each of these 4 different health areas separately, behind the scenes, they're really interwoven. So for example, we know that increases in contraceptive use reduce unintended pregnancies, which then has impacts on the supply needs for both abortion, Pac, and maternal health. And that, for example, increases in the use of hormonal methods influence the need for menstrual hygiene products. And so all of the projections that are done for LEAP account for these interplays between these different health areas. And so I think being able to expand LEAP beyond contraception into these 3 additional areas, all under sort of the heading of one report, brings a lot of value because it lets us think about these interconnections and how women's needs for products sort of vary over their lifetime. So today we're going to look a little bit at some results from these different health areas, but I'm not going to go into a huge amount of detail. So I wanted to encourage people, if they wanted a kind of more broad overview of each health area, that you can check out the webinar recording from the LEAP launch, which provides a much more detailed overview of each of the health areas. And it's available on the RHSC website with the link that you see on this slide. So in LEAP, we really start by looking at the need and the use of each of the reproductive health products. So look at either the women who are needing the different products, or in the case of maternal health, we talk about the cases for which the different drugs are needed, because one individual woman might need several different drugs throughout her pregnancy and childbirth. But we really kind of ground it in what is the use and what is the need. We then look at the quantities of drugs and supplies that are used, and then finally attach a cost to those, so that we're looking at both use from the perspective of the women, but also then what the cost of that use is. In each of the different health areas, costs are addressed slightly differently. Contraception is probably where we've gone the furthest, given the longer history of that work in LEAP and being able to really disentangle differences in costs between the public and the private sector, whereas for the other health areas, we're mostly just applying a single unit cost across all of the different commodities, using a range of different data sources to get to those cost estimates. The time frame of LEAP produces a current landscape. That current landscape is 2019, which now doesn't feel quite so current anymore, but when LEAP was first launched, that was sort of our last complete year of full data before COVID-19. And so wanted to be able to ground our current landscape where we both had comprehensive data, but also where we didn't sort of account for what we thought might have been atypical patterns of use given the pandemic. And then we project forward at a stopping point of 2025 and then on to 2030. For contraception, we project forward a single trajectory, while for the new health areas, we project forward 3 different trends, looking at different increases in coverage, as well as shifts in the types of products that women are using. Our estimates are produced for 129 low and middle income countries. The main LEAP report presents results aggregated together by income group, looking at low, lower middle, and upper middle income countries. And the custom reports provide additional ways to look at this data. So looking in terms of geographic regions and donor priority groups, for example, the USAID 24 priority countries or the GFF active countries, as well as for some of the health areas, providing the underlying country data as well. You can access LEAP through the URL seen here, leap.rhsupplies.org. And this is really where the report comes to life. So across the top, you'll see the main navigation pane, which lets you go between the different health area landscape reports, as well as the custom reports. We'll be spending most of our time today. But just before we get into that, I wanted to also point out this reader's guide, which can be accessed by clicking the link in the top corner. And the reader's guide provides a wealth of information on the methodology and other supporting details. So if we click on that, what you'll find is a box will pop up, and along the left-hand pane in this box, you can navigate through the different sections of the reader's guide. There's an overall reader's guide, which kind of gives general information about LEAP. And then each of the health areas has a specific reader's guide with all of the details about the data sources, the assumptions, the terminology used for each of those health areas. So one useful thing, especially as you start to look at the custom reports, is this page on income groups. So this map here shows you all of the countries that are included within LEAP. And here they're color-coded by which income group they're classified as, either low, lower middle, or upper middle income country. And this is following World Bank classifications for income group. So that was a very, very quick overview, but wanted to make sure that today we really spent most of our time on this new custom reports feature. Oops, sorry about that. So for each health area, there are 3 different custom reports. First, there is a custom landscape, which provides a detailed overview for a single country or region. This follows the same structure as the overall LEAP landscape reports, but tailors it down to the country or region that has been selected. The comparison report focuses on showing variation either across countries in a selected region or across regions for all low and middle income countries. And so this report is really focused on understanding variation and patterns. And then finally, the product deep dive lets you see results for a single product, for example, contraceptive implants or reusable menstrual pads, and provides a wealth of detailed information about where those products are used and how use and costs are projected to change over time. Depending on the types of questions that you might have and the type of information that you're looking for, one or more of these reports might be useful to you. Today, we're going to take a quick look at an example of each report, jumping around across the different health areas so that you can also start to see how these reports look a little different for the different health areas. We don't have time to get fully into detail for all of this, but really wanted to use today as an opportunity to highlight what each of the 3 reports looks like and show you some key features to ensure that as you start to explore these on your own, you kind of have an understanding of what to be looking at and where to find what you need. Just one more note before we get started. For contraception and menstrual hygiene, the custom reports make results available both at the country and regional level. This year, for abortion and Pac and maternal health, we're only showing results by region rather than by country due to data limitations in these health areas, where we're often reliant on regional rather than country-specific data. However, as more country data becomes available, so for example, colleagues at Guttmacher Institute have just recently published country-level estimates of unintended pregnancy and abortion for the first time ever, we hope to be able to also bring additional country visibility into LEAP as well. But for now, you'll see that for those 2 health areas, only these more aggregated regional results are available. So there are 2 different ways to get to the LEAP custom reports. You can either click the custom reports button in the header bar, or within each of the landscapes, you'll find a box with links to the 3 custom reports for that health area. So you can see here within the contraceptive landscape, you could link directly to one of those 3 reports or get there by clicking the button at the top. So with that, let's dive into the custom reports. So we're going to start with the custom landscape. Today, we're going to look at the custom landscape report for contraception, but a very similar landscape report is also available for menstrual hygiene, abortion and Pac, and maternal health. So here we are on the custom reports. You can see along the left-hand side, you can navigate between all of the different custom reports that are available. So right now, we're on the contraception custom landscape report. And each of the custom reports has a drop-down list at the top that allows you to customize the report. So for today, we're going to take a look at Eastern Africa, but that these could also be looked at for a variety of different regional breakdowns, donor priority groups, or countries. And so whatever you pick from this drop-down list, the report will be customized to show you results for that selected area. You'll find some general background text, and then as you scroll down, you'll see that the rest of the report is really tailored to the country or region that you have selected. Like the overall landscape reports, the custom landscape first grounds us in where we are now, looking at a detailed picture of current use and current costs for the selected area. You'll find that not only do the graphs update to show you the data for the selected region, but that the text is also customized. This gives you easy text to kind of pull out and put into other sorts of reports or documents or messaging, as well as having the graphs. I just want to point out a few other useful features within the custom report. So all of the graphs and tables can be downloaded using the arrow icon in the top corner. This allows you to download it as a picture, and then also to download the underlying data if you wanted to recreate graphs yourself. Most of the graphs also let you toggle between an absolute and a relative view, something that is also done in the main LEAP landscape. And this helps to let you see the data in different ways that provide a useful, different perspective. So for example, here, this graph is looking at the number of users by method and sector in Eastern Africa. The height of the bar shows us the total number of public versus private sector users. And we can see, because the first bar is much taller than the second bar, that there are many more public sector users than private sector users within Eastern Africa. But if we click to change this to the relative view, this now lets us compare the method mix between the public and the private sector. Here we can see that in Eastern Africa, injectables are the most common method among both public and private sector users, but that implants in that light orange color play a larger role in the public sector, while pills and condoms in the green and the purple play a more pronounced role in the private sector. So we don't have time to look today, but this report also has similar results for the cost of contraceptives, and then some comparisons between the profile of cost and the profile of use, which provide some useful insights into the contraceptive landscapes in these different countries. As you scroll down, you'll then get to results looking ahead to the future. As noted earlier, for contraception, we only have one future scenario where the total number of users is aligned with the UN Population Division projections. And then we develop projections for LEAP and changes of method mix that are aligned to recent patterns of change. So if current patterns in method mix change persisted, we would see that implants would grow most rapidly in Eastern Africa, and that by 2030, this would surpass injectables as the most commonly used method. Again, as you continue scrolling down, you'll see similar results to look at the change in costs, as well as these results on the changes in use. And then finally, if you just want the numbers, all the way at the bottom of the custom landscape report, you'll find a series of tables with all of the detailed results for the selected area, as well as a button that lets you download all of the data into an Excel CSV file, so that if you want to create your own graphs or do your own analysis, you have the data to do that. So that was a very quick overview of the custom landscape. So we're now going to look at our next custom report, which is the comparison report. For today, we're going to look at the comparison report for maternal health, but again, similar reports are available for the other health areas as well. So here we're on the maternal health report. For this comparison report, we can choose the regional breakdown for which we want to compare. So for this report, the comparison is across all low and middle income countries, split either by World Bank regions or UN Pop Division subregions. So here we've selected to look by the World Bank regional distinctions. For contraception and menstrual hygiene, the comparisons are within a selected region and results are shown by country, whereas for maternal health, abortion, and PAC, the results are shown by region. The maternal health report covers 7 priority drugs, and the future scenarios also incorporate 2 emerging drugs, as you can see on this list to the left. The comparison report lets you see how coverage levels vary across regions. So this graph is showing the number of cases that needed drugs for preeclampsia and eclampsia treatment. In the yellow, we see the ones that received magnesium sulfate, and in the gray, we see the ones that needed drugs but did not receive them. So you can see wide variation across low and middle income countries, from more than 70% in LMICs in Europe and Central Asia to less than 40% among LMICs in sub-Saharan Africa. And similar graphs are available in the comparison report for each of the different priority drugs. The report also looks at the cost of these priority drugs. So here again, we see how the costs vary across the different regions. So all of these bars sum to the total cost of maternal health drugs in low and middle income countries. And the length of the bar for each region shows us the total cost within that region. So we can see wide variation. This is driven both by the populations in the region, but also the burden and the need for different drugs. Looking at the colored segments of these bars, we can see which drugs are driving these costs. We see that in all regions, iron, folic acid, and oxytocin account for the largest shares, but that the cost attributable to these 2 drugs varies. So in some, the kind of relative size of those bars are bigger than in others. As we look to the future in the custom comparison report, we can compare in 2 different ways. First, we can compare by scenario over time. So this graph is showing us results for a single scenario. We can also look at this for all drugs or for selected drugs. And in this graph, each dot represents a year, 2019, 2025, and 2030. Here we're looking at scenario 3, where coverage increases and the use of the emerging drugs is scaled up. And we're looking particularly at results for the 3 life-saving commodities defined by the WHO as oxytocin, misoprostol, and magnesium sulfate. We can see that the gap between the dots varies, right? Which tells us that the amount of increase seen varies across these different regions. The second way that we can look at these results is to look at the 2030 endpoint, but compare across scenarios. So in this graph, each dot represents one of the 3 scenarios, showing us the totals for 2030. So here we are looking at costs. A similar graph is also available to look at cases. So for here, we can see that the magnitude of difference between the 3 scenarios varies across the different regions. And generally, regions where coverage started lower have a much larger gap between the 3 scenarios because the scenario where coverage is increased led to much bigger changes in places where coverage started off lower. So that was a very quick view into the custom comparison reports. And now finally, we're going to take a look into the product deep dive. And for this, we're going to take a look at menstrual hygiene. But again, similar reports are also available for the other health areas. So for each health area, you're able to select a single product or commodity or supply or drug, depending on the health area, and get detailed results. So here under menstrual hygiene, we're taking a look at reusable pads. This report is a little bit more like a dashboard than the others. So the other reports sort of provide more narrative and the graphs are really in the context of some narrative, whereas this report is more providing the data on how things are changing, looking at where users of the selected product live and how use of that commodity and the costs associated will change over time. This report is really most useful for those who are interested in a single product, for example, maybe a manufacturer. But we'd also encourage you to look at the other reports so that the selected product can be contextualized within a larger picture of use. It's for a lot of these, right, the changes that happen for one product sort of happen relative to changes for the other. And so it's useful to maybe first look at the landscape report to think about how that product fits into the wider picture before taking the deep dive into the single product. So in this report, we find some nice maps which show us the distribution of the use, the quantities, and the costs of the selected product. So here we're looking at the number of menstruators using reusable pads across the world or across low and middle income countries in 2019. The map can be scaled with and without China and India to see the relative size of other markets when these 2 larger markets are excluded. So you can see that the coloring just changes to show sort of the relative size, where the darker the color, the larger the market, and the lighter the color, the smaller the market relative to the full picture. We're also then able to look to the future as well. This map lets us get lots of different information. First, we're able to select which indicator we want to look at. So here we're looking at costs, but you can also look at users or menstruators in the case of menstrual hygiene and quantities of supply. And then we can choose to look at a different year, so either 2025 or 2030, or look at changes over time or the cumulative costs over the time period from 2019 to 2030. Here we look by a single scenario. So here we're looking at the 3rd scenario, where an increase in coverage is coupled with an increase in reusable use. And again, in this current view, we're excluding India and China, so to kind of see the visibility of those other markets. So again, the darker the coloring of the shading, the higher the costs are for that country. And if you hover over the graph, you'll get a little box popping up telling you the exact value for each of the countries. And again, this can be downloaded as data so that you have the numbers that sit behind the graph as well. So that was a very quick look into the LEAP custom reports. So just to kind of summarize all that we have here, LEAP has 4 different health areas: contraception, menstrual hygiene, abortion and PAC, and maternal health. For each of the 4 health areas, we have our 3 different types of custom reports: our custom landscape report, our comparison report, and our product deep dive. These reports are designed to meet different needs and answer different types of questions. So depending what you're looking for, you might need to go to one or more of these different reports. Results are available for 129 low and middle income countries, aggregated up into 6 World Bank regions, 16 sub-regions as defined by the UN Population Division. So if you want a little bit more regional granularity, you can use the UN Population Division sub-regions, and then 8 different donor priority groups that you can see listed here. LEAP custom reports bring a wealth of different information to your fingertips. Again, all of this information can be accessed at leap.rhsupplies.org. And we look forward to hearing more from you as you begin to explore both the overall landscapes as well as these custom reports. So today, the aim was really to provide just a quick overview of the custom reports. We hope that you'll spend some time exploring them and let us know what you think. This is a new area for LEAP. We had some sort of custom data available in the past reports, but not nearly as extensive as we have here. So we look forward to hearing what is useful, what you have found that you like, maybe what you are missing. Are there things you would have liked to see in these reports that you're not seeing there, so that as we think ahead to the next iteration of LEAP, we're able to ensure that that overall LEAP as a whole, as well as these custom report features, are really tailored to meet the needs of our community. So I am going to pause there and then see if we have some questions. We could also, if we have some time, potentially just open up the report and look around if there's things that people wanted to see that we did not touch on today. I see a question from Monica. Hello, Monica. It's been a long time. Nice to see you here. Asking about FP 2030 focal points and how they could use the reports, thinking about SIPs and other future investments. That's a great question. So we have custom reports. So we cover all low and middle income countries. So kind of cover the full set of countries that are falling into the FP 2030 universe of countries. And so here is a place where I think the custom landscape reports could be really helpful for those focal points, to be able to have a starting place of sort of an overview of what current use looks like. Of course, we know there are lots of other sources of information that countries are looking at to understand that current landscape. But also then thinking about those future changes and thinking about what would be needed to support those changes to go forward. So for example, in a lot of areas in sub-Saharan Africa, we've seen these really rapid increases in implants. And because the LEAP projections are built to sort of continue recent trends, we see those trends being continued on in many countries. And I think this opens up a lot of really good discussions about what investments would be needed to support that level of scale up, and what might be realistic within a different context to ensure that that full range of choice is available to women. Yes. So back to the question around visibility and country versus regional level data. So again, currently we are publishing country level results for 2 health areas, for contraception and for menstrual hygiene. For contraception, we are aligning to publicly available existing UN projections of contraceptive users in each of the countries, and then layering on our projections of method mix and sector mix, but that are informed by a wealth of country level survey data from DHS and Mix and PMA and other types of surveys. And so we feel pretty confident about having enough data to say something meaningful about what's happening at a country level. For menstrual hygiene, we've made estimates of the number of women who are menstruating in each country, informed again by UN projections of the number of women of reproductive age, and then taking into account other things like the share of women who are pregnant or postpartum or using contraception that affects their menstruation. And so have, again, I think fairly high confidence in our ability to estimate at least the total number of menstruators. For menstrual hygiene, I will say our data on the types of products that women are using is a little bit more patchy, but if you go to the custom landscape report, we give visibility for which countries we have country-specific survey data to inform that and where we're reliant on regional estimates. But we also felt that, especially because estimates are so sparse in the menstrual hygiene space, that there was a lot of value in putting out that country level data. When it comes to abortion and PAC and maternal health, we have a lot more reliance on regional data. So again, just very recently, colleagues at Guttmacher have published country level estimates of abortion just last week, in fact. But before that, the only kind of consistent cross-world, across low and middle income country abortion estimates that were available were published at a regional level, which meant that for any one country, we're having to apply these regional rates around abortion and unintended pregnancy, which is likely not going to reflect the reality of some countries, right? So we know that within a region, there's a lot of variation. And so we felt, given how much reliance that we have, both for abortion and PAC, as well as for maternal health on more regional data, that our country level estimates are not as robust as they are for the other health areas. And so have at this time, at least, again, just published these at these various regional aggregates. But we do see more and more country level data becoming available. And so hope that in the future, we will be able to bring additional visibility into countries. So one health area that we did not look at today is abortion and PAC products. Within LEAP, we look at a series of different products. So look at surgical abortions and PAC provided through MVA, as well as misoprostol only and combination misoprostol and mifepristone medical procedures. LEAP looks at future scenarios where we see both a kind of shift in safety with procedures becoming more safe, as well as that shift in safety coupled with an increase in the use of medical methods. I think one of the big things that we see in that, especially if we look at a shift from misoprostol only to combination procedures using misoprostol and mifepristone, is that brings a lot more use of mifepristone. And so that has big cost implications, especially at the current price points of mifepristone. So I think that there are some interesting things to think about from those results around how to ensure that as that move to more safe medical procedures that use mifepristone become more widespread, that can be done in a way that is not cost prohibitive. And look at different ways that those costs might come down. We have a little box exploring things like the price reductions that we see through combi packs, and also just more generally, as that market grows, we would expect there to be some market forces that lead to some price reductions as well. We'll give it a minute or two to see if there are other thoughts and questions. I also know that there is a lot in these custom reports. So it also encourage people, as you're spending time on your own, if you have thoughts or questions that come up, please don't hesitate to reach out. You can contact me. There is also a LEAP email address, leap@rhsupplies.org, and we'll make sure that your questions and messages make it to the right people to be able to help answer your questions. Great. So if we don't have any more questions, I know we're a little bit early, but sure, everyone is happy to get a little time back. I know if you're like me, you probably have back-to-back meetings these days in this working at home environment. So let people have a few minutes to take a break or go spend some time looking at the custom reports before you head off to your next meeting. So wanted to, again, thank everybody for their time this morning and for joining, and really encourage you to take a look at the custom reports. And then again, please reach out with any thoughts, any questions, things you like, things you wish you were there. So really looking to get more feedback from the community to ensure that LEAP is really a product that is usable by all, and supporting various members within the RHSC community to do what they need to do. So I look forward to hearing from folks more as they dive into the custom reports.